The earlier breast cancer is diagnosed, the better chance it can be cured. So how can we be breast aware? I've come to Imperial College London to speak to Charles Coombs and find out more. Charles, does being breast aware mean that we should be examining ourselves?
It means that women should look at their breast in the mirror and look for obviously any lumps,
Yeah.
any signs of a change in the shape of the breast, thickening of the skin, dimpling, that sort of thing. If you notice a lump or a change in shape, you should go and see a doctor.
So finding a lump doesn't necessarily mean you have cancer, it could be completely normal.
Most lumps in the breast are benign. I would
Okay.
say probably 90% of the time.
So what other symptoms, aside from lumps, should we be looking out for?
Well, some women experience a nipple discharge, and that is quite common. But if it's blood-stained, then that is an important sign to go and see your doctor with. Oddly enough, pain is more likely to be what we call benign. But pain that perhaps is persistent and doesn't change with your periods, that is important to take note of.
If someone has any of these symptoms and they go visit their GP, what is the doctor going to do?
Well, the first thing the doctor will do is to take a history and examine the patient. The GPs don't normally do x-rays and biopsies and i.e. needle tests. That will be done by a specialist in a breast clinic in the hospital. When the patient goes to the hospital, they will re-examine and then do a mammogram and may also do what's called an ultrasound,
Right.
which is another sort of scan, and may also do a needle test where they put a needle in the breast and take out some cells for examination.
I understand there's also a screening program involved. Can you explain to me what this is?
The screening program in the UK is, on the whole, from 50 to 70. Women, if older than 70, can request continued screening. What it consists of is a mammogram only. It takes a very short time.